Okay, welcome back. Now we're going to move on to connective tissues, folks. Now, a few general things about connective tissues, a few general characteristics about them, so to speak. The first one is connective tissue is the most abundant tissue found in our body. And another big thing is, whereas in epithelial tissues, the cells were tightly packed together, in connective tissues, the cells are more spread apart, are more spaced apart, which allows blood vessels to enter the area. So another big difference between connective tissue and epithelial tissue is connective tissue is very vascular, which contains a great blood supply. Which means in the terms of healing is if we damage connective tissue, there's a much better chance of it recovering due to the blood supply. There is one exception to the rule though, folks, just like everything in anatomy and physiology, and another thing just like in life. Cartilage. Cartilage is the one connective tissue that does not have a good blood supply. So when we damage that, the chances of cartilage coming back is very slim. So, and that's why once arthritis usually affects a person, they never get rid of the arthritis. So that's just some general basic information about our connective tissues. So what we're going to go into is the first tissue we're going to look at is dense connective tissue. So we come right here. Here is our dense connective tissue. We hit on it. Now what we're going to see is we can see all of the cells, and we can see how much more spaced out they are in this tissue as compared to epithelial tissue. Now the structure is in bold in your checklist. Always important to know. Anytime you see something bold in your checklist, always important to pay attention to. The predominant type of fiber that makes up this tissue is collagen fibers. And we can see collagen fibers have a slight wave to them in dense connective tissue. And you can see there's a collagen fiber running right there. Here's a collagen fiber running right here. Here's a collagen fiber. So the collagen fibers are very wavy. And then what we see here, the term fibroblast or fibrocytes, those are the cells that help contribute to this tissue. And here is a fibroblast or a fibrocyte right here. So when you are looking at dense connective tissue, again, look for the very wavy collagen fibers. And that's a very good indication that you're on the right path to identifying it. Now, collagen fibers, when collagen is part of something, it helps really give it a lot of strength and support. And in this case, this tissue is solely made up of collagen fibers. So the dense connective tissue is a very strong tissue. And in fact, the locations of this are tendons and ligaments. And again, what are tendons? Tendons are connective tissue structures that connect muscle to bone, and ligaments are connective tissue structures that connect bone to bone. And again, what are tendons and ligaments made of? They're made of dense connective tissue. The next one is loose connective tissue. And as we come right here, here's loose connective tissue. You can also call it areolar connective tissue. And what we have is we just have a pretty big mess on the screen right here, folks, on what you can see. But what can we see? Again, we can see fibroblasts, and we can see them more spread out. Okay, not tightly packed together. Now, in addition to collagen fibers, we also have elastic fibers. And what the elastic fibers give a tissue a little bit of stretchability or pliability, so it's not as rigid. And so when you're trying to identify the elastic fibers in here, what you are looking for are these very thin black lines running throughout the tissue. Here's an elastic fiber here. Here's an elastic fiber here. Now, the collagen fibers, where will we find the collagen fibers? It's these thicker pink fibers running right here. You can see one right there. You can see here is a collagen fiber running right here, much thicker than the elastic fibers. Now the location for this tissue, folks, that will be the dermis of the skin. The dermis is the layer right underneath the epidermis, and this is where you're going to find loose connective tissue. Next tissue that we need to know is adipose tissue. So here is adipose tissue right here, folks. Now again, when we look at adipose tissue underneath a microscope, a lot of times it either comes out white or yellow, and in this case it's white. So when this is adipose, so what you're looking at, you're looking for these somewhat circular or oval shaped cells. And the name of these cells in adipose tissue are called adipocytes. Now, what we can see here when we look at this cell in particular right here, this black dot right here, that is the nucleus of the cell. When these cells become filled with fat, all the organelles get pushed off to the side. So far, we've shown you all the nuclei have been right in the middle of the cell. But in this case, with adipose, as fat fills the cell, the organelles get pushed off, but the nucleus still remains visible on the outermost border. And that's what happens to the nucleus in adipose tissue. So again, you're looking for circular, oval-like cells. Locations. You find this in the subcutaneous layer of the skin. This is the layer that is deep to the dermis. The subcutaneous layer is what covers our bones and muscles. Also, you find adipose tissues surrounding all of our internal organs. There's a fair amount of adipose tissue that surrounds the internal organs of our body. Also, too, genetics plays a role in adipose tissue on where we hold adipose tissue. Men usually tend to hold adipose tissue in their abdomen, where women tend to hold adipose tissue in their hips. So that's adipose tissue. Now we're probably going to move on to one of the easiest tissues to identify, and that is going to be bone. And what we're going to first look at is compact bone. And then here's bone right here. Now again, why do I say it's easy to identify? Because you have these circular structures that make up bone right here. They actually look like tree trunks. And that's what a lot of students say. It looks like tree trunks. And so this is compact bone. Now when we look at compact bone, folks, here it is right here. Okay, this is all right here. But on this bone right here, we have cut it open. And so what we're going to come up with and show you the difference. There's two types of bones that we're going to identify, compact bone and spongy bone. When you look at this very thick, dense bone on the outermost border of the bone, that is compact bone. And then when we move inside the bone, you can see how it thins out a little bit. That real thin part of bone right there, that's called spongy bone. Don't let the name fool you. Spongy is just a different name. If you were to step on spongy bone, you are still going to cut yourself because it is still very sharp and dense. But again, so if we look right here, compact bone on the outside, spongy bone. If I come here, you can see compact bone, and you can see spongy bone's more porous. Now the importance of spongy bone, folks, this is where we find our bone marrow. And this is where blood cell production will occur within our spongy bone, within the bone marrow. Okay? So again, that is compact bone, very easy to identify, we believe. Now, if we look, the structures that we want you to know, first one is the osteon. The osteon is this circular structure right here. This is the functional unit of compact bone. So we have an osteon here, we have an osteon here, an osteon there, an osteon there, but it's this whole circular structure. Now the next structure, right here, is this little black speck right here, and you can see them everywhere. Right up here, here. Those are the bone cells, and those are called osteocytes. Osteocytes are mature bone cells. And then the next term that we want you to know is a lacuna. Now, what a lacuna is a space or depression in which the osteocyte sits within. We will not see it on a picture of the microscope, or of a microscopic view when the osteocyte is there, because the osteocyte takes up the whole space. But we do want you to know that a lacuna is a space or depression in which the osteocyte sits within. Okay? The next one then, spongy bone. Here's spongy bone right here. Now again, unfortunately, it's not the most clearest picture, but if we look real close, all these little black specks right here running through these grayish structures, those are the osteocytes, folks. And again, what do they sit in? A space or depression called a lacuna. Now, what spongy bone is made up of thin branching pieces of bone. And those thin branching pieces of bone are called trabeculae. And what they do is they intertwine and crisscross with each other, almost to form like a screen or a mesh. So if we come back to this picture, if we come up real close here, can you see those thin little branching pieces of bone that are all like interwoven together? Those are the trabeculae. And then what is sitting in between the spaces of those trabeculae? Again, that's where our bone marrow will sit, folks. And that's, again, where our blood cell production occurs. So if we look on here, on the APR picture, this is a trabeculae right here. Here's a trabeculae. Here's a trabeculae. So all of these grayish, bluish structures, those are all trabeculae. Where do we find them at? We find them within the ends of our bones, or within cavities of bone. That's where you find spongy bone. Okay? Now the next three then are the cartilages. We have three types of cartilage, folks. We have hyaline cartilage, fibrocartilage, elastic cartilage. And again, what makes these three connective tissues different from the other connective tissues? They have a terrible blood supply, horrible blood supply, that if they become damaged, the chances of recovering are very slim at all. So when we come down, we're going to come over here and we're going to first look at hyaline cartilage. And here's hyaline cartilage right here. Maybe. There it comes.
Oh, pretty. So
here's hyaline cartilage right here. Now, if we look at the bold terms right after they identify the chondrocytes. Chondrocytes, quite simply, folks, are cartilage cells. So here's a chondrocyte right here. Here's a chondrocyte right here. Here's a chondrocyte right here. They also, too, sit in a space or depression called a lacuna, folks. So again, just remember, a lacuna is a space or depression which houses a cell. If it's a bone cell, it's an osteocyte. If it's a cartilage cell, it's a chondrocyte. Now, there's another term that we haven't talked about, and that's the matrix. And what the matrix is the substance that is found between the chondrocytes. The matrix of connective tissues give those tissues their characteristics and their textures. Like bone, for instance, does it have a matrix? Yes. What is the matrix of bone? Something that's very solid and very dense. But if we look at the matrix of cartilage, the matrix of cartilage is the texture of almost a firm plastic that's slightly flexible. Again, that's a big difference between the matrix of cartilage versus the matrix of bone. Now, when we look at hyaline cartilage, what we want to look at, the big key is, I always say, look at the matrix. The matrix will tell you a lot about what type of cartilage we're looking at. If you look at the matrix in between the cells, it has a very smooth appearance right here. You can't see anything. It's almost clear to my knowledge, or to what I'm seeing. And this is very important because a lot of times, folks, in A&P, structure and function are always interrelated. Structure and function are always interrelated. So here's the big thing, folks. Where's the location of this tissue? Hyaline cartilage. It's found at the ends of our long bones in movable joints. Now, if you come on back and you look, if you look at this, you see how smooth that is. Now imagine two surfaces of bones moving on one another. Do we want something nice and smooth that's going to allow for easy transition of movement? Or would we want something really rigid and cause movement to become very agitated, very disturbed and troublesome for us? No. So that's how I always associated hyaline cartilage, based off of that smooth matrix. Also, another location that we will find this type of cartilage, it's found between the ribs and the sternum. And it also lines the trachea. That's hyaline cartilage. Okay. The next one right here, it would be fibrocartilage. And here's fibrocartilage. Now again, when you first look at it, let's look at the matrix. We can see the chondrocytes right there. Yes, they're sitting in the lacuna, but now when we look at the matrix right here, folks, we don't see a nice smooth matrix. No, what do we see? We see these wavy fibers right here. There's a large number of collagen fibers, folks, that are found in the matrix of fibrocartilage. So again, if you start looking at these tissues, you will start to very easily identify the differences between the tissues. Okay, so again, hyaline cartilage, clear matrix. Fibrocartilage, matrix with wavy collagen fibers. Okay, now the locations for this one. Here they are right here. The first one is the pubic symphysis. It's the joint that is formed between the two hip bones that when they meet anteriorly. There's a large piece of cartilage that is found between those two bones right there. And that is the pubic symphysis. That's where we find fibrocartilage. Also where we find it at, is we find it in these structures that run between our vertebrae. Those are called the intervertebral discs. They are made of fibrocartilage. So the next time someone talks about a herniated or a bulging disc, what are we talking about? We are talking about the intervertebral discs. And what are they made of? They are made of fibrocartilage. And those are the only two locations you need to know for that. And then last but not least of all the cartilages, we have elastic cartilage. Now, I want you to stop and think of the name, folks, real quick. Elastic cartilage. Mr. Fogle and I are going to give you 10 seconds to guess what type of fibers you will find in the matrix of elastic cartilage. Go. You probably guessed it already. All right, so here we go. Elastic cartilage, folks. Not the best picture, but we can see the chondrocyte. Chondrocyte, chondrocyte. What do they sit in? They sit in little spaces called lacuna. Now, when we look in the matrix right here, we can see these thin black lines running through the matrix. These thin black lines, yes, those are elastic fibers, hence the name. What fibers are found in the matrix of elastic cartilage? Elastic fibers. So that is elastic cartilage. Location. First one is the external ear. Go ahead and do that, folks. Flip your ear over and let it go. What happens? The ear snaps right back into place due to the elasticity of the cartilage. And then also another location where you find elastic cartilage is the epiglottis. That is the structure that blocks our airway when we swallow food or liquid. Now, blood is a unique connective tissue because it's the only tissue in our body that is a liquid. Okay, it's the only tissue that's a liquid. But blood is considered to be a liquid. And here it is, folks. So, again, when we talk about it, I know the term's not mentioned, but the matrix. The matrix is, again, the substance between the cells of a connective tissue. So in this case, what is the substance between the cells of blood? It's plasma, which is the liquid component. Now we have three structures that we're looking for or three cell types that we're looking for in our blood. The first one, and should be the most numerous of all the cells, are the red blood cells. So here they are right there. There's the red blood cells. Now, first thing first, red blood cells do not have a nucleus. Even though this white area looks like it's a nucleus, it's not a nucleus. The red blood cells are very thin in the middle. But that is a red blood cell. And we will take the term red blood cells or erythrocytes. Whatever you guys feel more comfortable with, go with that. The next the next type of cell we should see are leukocytes or our white blood cells. And here we have two of them. So here's one right here. And what we can see is a nicely stained purple nucleus. Yes, the nucleuses are a little odd shaped in white blood cells, but we can still see them. They are multi-lobed. That's what gives them their funny looking appearance. And then we come down to this one. Here's a nucleus right here, but we can see them nuclei stained nice and purple for us. And those are the white blood cells. And with all due respect, we should not see many white blood cells present in a sample of healthy blood. So this is fine. And then last but not least, platelets, which are not actual cells, but cell fragments. But here are platelets right here. All these little specks that look like dirt on the slide, those are platelets. And we know that their job is involved with clotting. And yes, you can call platelets thrombocytes if you would like. But again, it's up to you. I always say when you have multiple chances to name something, pick the term that you feel the most comfortable with. Okay? Last tissue coming up, folks, nervous tissue. Nervous tissue is just nervous tissue. There's no fancy name for it. So here it is right here, folks. Now, when we look at it, location, I'll let you guys name your location about what you think about the appearance of what it looks like to you. But there are two types of cells that we were looking at right here. And those are the neurons and the glial cells. The neurons are the primary cells of our nervous system because the neurons are what transmit and send nerve impulses. And that's how the nervous system communicates with our body. The second type of cells are support cells, and those are the glial cells. And there are about 7 glial cells, and they all have various functions within the nervous system, and we will talk about those when we get to those. So if we come up and we just look at the picture here real quick, folks, this huge cell right here, that is the neuron right there. That is the neuron. And again, what's its job? To send and receive nerve impulses. If we look, what can we see right here? What organelle? That is the nucleus right there. And then what is that dense region sitting right in the middle of the nucleus? That is a nucleolus. For some reason, underneath the microscope with stain, the nucleolus of a neuron shows up very clearly. But we can see a nucleus, and right in the middle of the nucleus, there's the nucleolus. And again, that's just good information right there. And then all of these little black dots right here, those are the glial cells. Do you need to know their individual names right now? The answer is absolutely not. All know them as glial cells. And again, location of this tissue, quite simply put, brain, spinal cord, and nerves. That's where you find nervous tissue. Again, Mr. Fogel and I apologize that we did not give you more information for these labs, but we will work and try to do a better job. So start studying this. We are going to get this posted right away to your Blackboard. Thank you.